Did you know that centuries before modern medicine, ancient Talmudic scholars were conducting sophisticated medical research, performing surgeries and discovering critical medical insights still relevant today? Join me as we explore the astonishing contributions of the sages of the Talmud, whose groundbreaking work set the foundation for medical science as we know it. When we talk about medical pioneers, names like Hippocrates, Galen, or even Avicenna often come to mind. But lesser known yet profoundly influential are the scholars of the Talmud who made strikingly advanced discoveries centuries ahead of their time. From anatomy to pathology, their remarkable insights demonstrate an unparalleled depth of understanding about human biology and disease. Talmudic anatomy wasn't just theoretical, it was richly detailed and startlingly precise. For instance, Yehoshua Leibowitz highlights in his Encyclopedia Judaica entry that Talmudic sages accurately described tiny cartilages in the trachea, details only rediscovered by modern medicine in the 17th century. Dr. Avraham Steinberg further emphasizes that the Talmudic scholars not only observed anatomy passively, but actively engaged in dissections and experiments. Sources like Tosefta Nida and Tractats Bechorot and Nida document systematic post-mortem analyses, gynecological examinations, and even embryological studies, nearly 1,500 years before these became standard practices. In pathology, these ancient scholars were truly revolutionary. They were the first to grasp that disease symptoms corresponded to structural anatomical changes in tissues, a concept aligning closely with modern pathology. They examined animal organs for abnormalities, identifying conditions based on color, shape, location, and presence of parasites. Contrasting sharply with Greek theories of bodily humors, Talmudic pathology offered structural explanations for diseases, making it far more akin to contemporary medical science. Steinberg rightly notes, the medical knowledge of Talmudic scholars exceeded the general medical standards of their time. The Talmud contains astonishing examples of advanced medical procedures. For instance, the sages were among the first to recognize hemolytic jaundice in newborns, advising against circumcision in affected infants, knowledge absent in ancient medical literature until recent centuries. An extraordinary narrative in Tractate Shabbat describes a man who miraculously nursed his infant after his wife's death. While seemingly improbable, modern endocrinology confirms that, under rare hormonal conditions, men can indeed produce milk. Talmudic scholars made surprisingly accurate surgical observations. For example, they correctly noted the liver's remarkable regenerative abilities centuries before Greek physicians like Galen misunderstood it as irreparable. They also accurately concluded that removal of the spleen isn't fatal, a fact unrecognized in Western medicine until the 16th century. Even intricate surgical techniques such as removing the womb from animals for economic purposes astonished European surgeons centuries later. A prominent 19th century surgeon expressed amazement, noting that such complex operations were documented in Talmudic texts 2,000 years prior to their discovery. One of the Talmud's most stunning medical insights involves circumcision timing. Ancient sages prescribed the 8th day after birth as optimal. Modern medical research confirms precisely this timing, noting elevated vitamin K and prothrombin levels, essential for blood clotting, peak exactly on day 8, dramatically reducing surgical risk. Talmudic scholars identified ways diseases spread long before germ theory emerged. They recommended circumcision for disease prevention, linked sexual promiscuity with specific infections, and even advised on avoiding disease transmission through insects and airborne contagions. Their guidelines closely resemble modern epidemiological practices. Beyond human medicine, Talmudic scholars made substantial contributions to veterinary medicine. They differentiated between reversible and irreversible animal injuries and were aware of anatomical similarities between humans and animals, notably pigs, a modern scientific realization. Intriguingly, they also understood rare anatomical conditions like abnormal connections between the respiratory and digestive systems in newborns, diagnoses modern doctors could only confirm through invasive procedures or imaging. These ancient medical insights haven't gone unnoticed in contemporary medicine. Doctors Y.B. Borman and Y.T. Davidson from Hadassah University Hospital highlight how Talmudic descriptions of successful tracheotomies predate widespread medical use by centuries. Modern surgeons and medical historians frequently recognize Talmudic scholars as true pioneers, whose profound anatomical and medical knowledge remains impressive today. In summary, the Talmudic sages were not merely theologians or philosophers, they were exceptional scientists whose empirical approach anticipated modern scientific methods by millennia. Their keen observations, rigorous experimentation, and revolutionary medical procedures were groundbreaking and continue to inspire medical researchers today. The remarkable blend of religious scholarship and practical scientific inquiry, evident in the Talmud, serves as a powerful reminder of humanity's enduring quest for knowledge, one that bridges spiritual wisdom with empirical investigation. If this exploration of ancient wisdom and modern medicine intrigued you, please like, share, and subscribe for more fascinating journeys into history's hidden insights. Join us next time as we uncover another incredible chapter from our rich intellectual heritage.